Another sort of tool or potential intervention that's thrown out there for as an adjunct or a consideration during cancer treatment is this idea of fasting. And in many ways, there's a bit of overlap here, I think, with the ketogenic diet and kind of this idea of starving cells, cancer cells. It would seem to me at a high level here, just thinking about the importance of avoiding unintentional weight loss and muscle loss, that would need to be really balanced with fasting. Is that your view? And is there any potential benefits of, yes, having some sort of fasting protocol, but still making sure that you're getting enough protein and energy?
Yeah, so there is, I know many clinical trials undergoing now looking at fasting or fasting mimicking diet. There has been some published clinical trials, but with small samples and quite diverse samples. And say one of the largest ones was in breast cancer, right, which is a population maybe not at as high risk of malnutrition as, say, pancreatic cancer. So I think there might be some populations that it is worth studying because they're at lower risk of malnutrition. I think to put someone on 5 days of 300 calories that has pancreatic cancer, that sounds very risky for me. And do we really have, yes, there's a little bit of research on it might reduce the severity of some side effects for their chemo. I want to see survival outcomes. That's very different. And so is it really worth their nausea wasn't as severe, but you put them through that and it didn't actually benefit any survival outcomes or response to therapy outcomes. So I think I'm paying attention to it. I'm not throwing it all out. I'm watching that research, but right now I think it's too early. There's a lot of little small studies. And back to that example of that breast cancer, that study done in individuals' breast cancer, only 50% completed 2 cycles of that fasting mimicking diet, only 50%. So that just shows like a really big barrier is going to be, can people even do it? Why put them through this? They can't do it. It's difficult. And we're looking at, again, a population that is not at very high risk of malnutrition and still found it very challenging to even do 2 cycles of this fasting.
Yeah, it's just another example of where something may have therapeutic utility and on paper may seem really beneficial, but until you've tested it, until you see whether people are able to adhere to it, until you see what are the unintended consequences, it's very hard to make a kind of risk reward call on whether that's something that you want to do as an individual or whether you want to recommend it, put in the guidelines, all of that sort of stuff.